Within the Med-IPUT project, we're trying to develop a revolutionary new ultrasound transducer, which uses light to receive sound. And the reason for that is because we've seen that conventional techniques are hitting a wall in terms of sensitivity. So we're trying to use a different kind of physics, namely the interaction of light and acoustics, to make a much more sensitive ultrasound transducer. And the reason for that is because we've seen in the past that if we have more sensitive hardware, we can create better quality ultrasound images. And with that, with these clearer images, clinicians can make better diagnosis, which leads eventually to improved patient health. We intend to not just create the theoretical background, but also make a usable phased array medical ultrasound transducer, which we can use to show on in vitro phantoms that the concept works and is better than what is out there now. We're involving partners from both the optical side, optical foundries, and we're involving partners from the transducer side to have input across the entire fabrication chain to make this as practical as possible. In the first year, what we have achieved is that we've proved that we can transfer the high sensitivity per unit area of the IPUT concept, the integrated photonic ultrasound transducer concept, into actual sensitivity. So we managed to create devices that have a 90 times lower noise equivalent pressure compared to the state-of-the-art ultrasound transducers. And by that, proving the point. The next steps for this project is, one, to make the IPUT devices into separate array elements. Two, to design the optical chips to read out these array elements. And three, eventually to make a full array of this, full ultrasound array, which will then be combined with a transmitter array to make a prototype that can actually show the strength of the concept. If we manage to do what is in the plan of the Med-IPUT project, then this will lead to much more sensitive medical ultrasound transducers, which can either be used to either have a higher penetration, so help patients that are difficult to image, or can lead to higher quality images. And in the end, the aim is for the doctor, for the clinician, to have a better quality image for them to do their diagnosis on. And then the hope is that these better and clearer images will lead to increased patient health because of these better diagnoses.